How are blood tests used to diagnose epilepsy? Blood tests are an important part of understanding seizures and epilepsy, but they do not directly diagnose the condition. Instead, they help doctors gather clues about what might be causing seizures and guide treatment. When someone has a seizure, doctors often start with blood tests to look for other possible reasons, like infections, metabolic issues, or other medical conditions that can mimic epilepsy. Blood tests cannot tell if a person has epilepsy on their own. The main test for diagnosing epilepsy is the electroencephalogram, or EEG, which records electrical activity in the brain. The EEG can reveal abnormal brain wave patterns typical of epilepsy. Blood tests are used alongside EEG and imaging tests like MRI or CT scans to build a complete picture. One key role of blood tests is to rule out other causes of seizures. For example, they can detect low blood sugar levels, electrolyte imbalances like sodium or potassium problems, or infections that might trigger seizures. Identifying these issues helps doctors decide whether the seizures are caused by a treatable condition rather than epilepsy itself. Blood tests also help assess overall health before starting medications. They check kidney and liver function, which is important because these organs process anti-seizure drugs. If there is damage or disease in these organs, it can affect how medications are used and dosed safely. The complete blood count test measures red and white blood cells, platelets, hemoglobin, and hematocrit. This test can identify infections, anemia, or allergies that might influence treatment choices or cause symptoms similar to seizures. The chemistry panel looks at blood levels of sodium, potassium, and blood sugar. It also includes kidney and liver function tests. These are all important because imbalances or organ problems can increase seizure risk or affect medication effectiveness. After treatment begins, blood tests are used to monitor medication levels. Measuring the amount of anti-seizure drugs in the bloodstream ensures they stay within a safe and effective range. Too low, and seizures might not be controlled. Too high, and side effects could occur. Research is ongoing into blood biomarkers that might someday help diagnose epilepsy more directly. Scientists are studying proteins released into the blood when brain cells are injured, such as S100B, neuronal-specific enolase, and glial fibrillary acidic protein. Elevated levels of these proteins have been observed in people with epilepsy, especially during or after seizures. However, these biomarkers are still in the research phase and are not yet used routinely in clinics. Genetic testing is another blood-related tool. Blood or saliva samples can be analyzed for gene variants linked to epilepsy. This is especially helpful in cases where epilepsy runs in families or when a specific genetic syndrome is suspected. Identifying genetic causes can help tailor treatment and provide important information for family planning. In practice, when someone experiences a first seizure or is suspected of having epilepsy, doctors usually order blood tests as part of the initial assessment. The blood is drawn from a vein in the arm and sent to a lab for analysis. The results help doctors understand the person's overall health, identify possible triggers, and decide on the next steps in diagnosis and treatment. It is important to remember that blood tests are just one piece of the puzzle. The most critical test for epilepsy remains the EEG, which directly measures brain activity. Blood tests complement EEG and imaging studies by providing additional information about health, metabolic status, and genetic factors. Combining these tools allows healthcare professionals to make the most accurate diagnosis possible. In summary, blood tests are valuable in epilepsy evaluation mainly for ruling out other causes, assessing health before treatment, monitoring medication levels, and exploring genetic factors. They do not diagnose epilepsy by themselves but are an essential part of a comprehensive approach. Anyone experiencing seizures should consult a healthcare professional who can determine which tests are appropriate for their individual situation and provide personalized care based on their needs.